The current global pandemic surrounding COVID-19 is real and can be frightening. The uncertainty around the virus, our personal risk, the risk to our loved ones, and not knowing when all of this will end can bring about feelings of fear, anxiety, and sadness. There is no right or wrong way to feel in situations like this, and people who already experience some anxiety or feelings of loneliness and isolation may find their symptoms worsening right now. It's important to be kind to yourself. We are living within extraordinary circumstances, and it is a stressful time for everyone, so it's okay if you feel a bit more anxious than usual, and it's definitely okay to take time for yourself to manage your mental and emotional health. Here are a few tips from our lung ambassadors to help achieve and maintain better mental health.
Hi, my name is Anne, and I have lung disease and use oxygen. Some days it's a struggle to have a positive attitude. My best solution is to go for a walk or do some exercise. Being active is so important to our well-being. Find something that you like to do and you will feel much better. It doesn't have to take a lot of time, but you will be surprised at how much better you feel.
Day-to-day living with a lung disease can be extremely difficult, especially in these times of COVID-19. So ensuring that I do things to help to maintain positivity, both physically and mentally, is paramount for me. Something that helps me is mindfulness meditation. I practice on a daily basis, and I find that this helps me to stay grounded, to stay in the moment, and to find something to be grateful for every day. Hobbies are an individual choice, so whatever brings you joy, now is the time to do it. I like adult coloring books, and I also like to make personalized cards for family and friends. It helps me to relax and to keep my focus on positivity and things that are very, very positive. These kinds of activities help you keep your mind functioning and to help keep you grounded to relieve stress and worry.
Exercise starts for me first thing in the morning by getting up and making my bed. I then do some light stretching and look after my hygiene. And from there move through the house doing some easy chores and activities to straighten up the house. I then like to make a meal, and after making a meal, take the dog for a walk. After walking the dog, come back and have a little rest, and then do a little bit of weight training, whether it's with actual weights or with cans of soup or something. I like to do something, and stretch with the rubber bands. After that, just again to wind down a little bit, make a puzzle or do a model or, watch a movie, read a book, something like that. And then after that, I like to, whenever nobody's around, do a little singing, pretend I'm a rock star. And the best thing after that is the best solution to everybody is remember the laughter cures it all.
Hello, my name is Heather, and as a person living with lung disease, it's not easy at the best of times, but during a pandemic, you feel especially vulnerable. To cheer myself up during this isolation, I FaceTime or Zoom others, including my grandchildren, and it's a pleasure to read them a story or admire their artwork, or just to enjoy talking to a friend I know who lives alone and try and cheer them up. When I do that, I find it cheers me up too.
Maintaining positive mental health right now is difficult. It's very easy to slip into the doldrums. Keeping active and maintaining a schedule is what works for me. Living with COVID-19 is very much like living with COPD. You have to maintain control by doing what is best for you, by making the most of every day and accepting the new normal. If I find myself beginning to slip into the doldrums, I go into my room, turn on some music, and have a good cry. It allows me to release my feelings. Then I can get up, move on, and start to feel better again.
During the isolation, during the COVID-19, I have found that the electronics have really helped me through the long, lonely days. First of all, being a 78-year-old senior, electronics are not that familiar with me. But I'm blessed that I have a long-distance free program throughout Canada, and I'm able to call family and friends in New Brunswick and British Columbia, as well as different parts of Ontario. Also, I have my laptop, which enables me to keep up with current events. I'm also on Facebook, and I'm able to also contact friends and family. The most important to me is my iPad. I'm not that familiar with it, but I do have a few talents, such as FaceTime. And that to me is such a blessing, because my daughter in Brantford is able to FaceTime me when my great-granddaughter goes to visit her Nana. But also missing my two granddaughters, Taylor and Maddie, for our tea times and talk times, I'm able to FaceTime them during these long days. I pray that all of you stay home, you stay strong, and you stay connected. Thank you.
Please don't hesitate to reach out and ask for help if you ever need it, whether that be to a family member, friend, your doctor, calling a support service, or the Lung Health Foundation. Please feel free to call our Lung Health line at 1-888-344-LUNG or 1-888-344-5864, or visit our website at lunghealth.ca, or email us anytime at info@lunghealth.ca.